stay healthy, you need to get your shots.
Right.
People don't realize that.
Influenza vaccination is one of the key components of how we successfully prevent the spread of disease.
As of 2016, pharmacists had their scope expanded to be enabled to administer a list of 13 vaccines.
From the Zoomerplex in historic Liberty Village, the Zoomer with Marissa Lennox.
Welcome to theZoomer, I'm Marissa Lennox. Today we tackle a subject that not only affects our personal health, but one which carries public health benefits for entire communities. I'm talking about immunization. It is the single most cost-effective healthcare investment available to Canadians. Still, many, particularly older adults, skip needed vaccinations. Why is this? What are some of the barriers? And how can we break through those barriers to ensure that more Canadians protect themselves against infection and illness? We've convened an expert panel to tackle this important issue, but before we dive in, let's tee up the topic.
With the threat of coronavirus spreading around the world, we are reminded of the importance of vaccines. And even though there is no vaccine to prevent coronavirus, getting vaccinated against respiratory illnesses like the flu is recommended to protect your health. But not enough Canadians are up to date. According to the numbers, about 30% of people 65 and older skipped their flu shot last year. And about 2/3 didn't receive the recommended shingles vaccine. When it comes to protecting ourselves, 1 in 4 say getting vaccinated isn't a priority. And less than 50% say it's as important as making sure our children are. One example, only 42% of older adults are vaccinated for pneumonia, compared to over 80% of children. While most Canadians, 88%, believe they are up to date on their vaccinations, only 3% have actually received the right number of vaccines for their age. Surely we can and must do better.
Now, Natasha, with all this talk about coronavirus, it's on everyone's minds, and yet we don't have a vaccine yet. So in the absence of a vaccine, how are we to protect ourselves?
So the coronavirus is spread through the air and on surfaces, and it's a bit like flu in the way it's spread, as far as we're aware. So all the things you do to protect yourself from diseases like flu apply to coronavirus. If you're coughing, cover your cough into your sleeve. Wash your hands regularly. You've got to think about not infecting others if you're sick, so don't go to work. Stay at home and practice good basic hygiene.
And that's important information, but the other thing we continue to hear, Iris, is that one of the ways you can protect yourself is through ensuring you are vaccinated from other respiratory illnesses like the flu. So does the flu vaccine protect you from coronavirus?
Absolutely not. It does not. I mean, the thing about it is when you consider the true risk of coronavirus, what are we up to now? Maybe you can help me. Of some 30 cases in all of Canada. The likelihood of any one doctor seeing it or of any one patient even having an indirect contact with it is not just low, it's for all intents and purposes 0. So from my perspective as a family doctor, here are the number of cases of influenza. Massive. The number of deaths number in the thousands. And in fact, if there were another 30 cases or 40 cases, no one would even sneeze at it. Who would care? It doesn't even make a difference.
Okay, but coronavirus aside, you still wouldn't advise your patients, even though there is the coronavirus out there, you wouldn't advise patients to get vaccinated for the high-dose flu in order to protect against coronavirus?
Of course. I mean, that's one of the most important things we can do, because influenza vaccination is one of the key components of how we successfully prevent the spread of disease. True, in any given year, it's not 100%. We're talking about an efficacy ranging from 40 and in a good year, maybe 50, 55%. But it's still one of the best protections we have. And even now, it's not too late to get vaccinated. However, it does take a minimum of 2 weeks for the body to have a positive immune response.
We just saw in the Kinetic earlier, 88% of Canadians think that they're up to date on their routine and recommended vaccinations. In fact, only 3% are. What are some of the barriers, David? I mean, frankly, why do you think that is?
I think the biggest barrier is education and the fact that adult vaccines, the whole topic, and I'm, of course, coming from a completely layman's point of view on this panel, is a relatively new thing. So you've got very spotty information we all associated vaccination with childhood. You know, when I was a little kid, I got my shots. As a young parent, my babies and children got their shots, and you think it sort of ends then when you've finished immunizing your baby or your young child against measles, tetanus, whooping cough, whatever that whole series was, we're done. So there's a very big lack of awareness of what is out there. A little bit better around flu because in the last 20 years or so, there became the concept of the flu shot every fall. Go and get it, maybe yes, maybe no. But I think that the biggest barrier is we don't know. We absolutely don't know what's out there. What does the word even mean? What's available to me? How can I know if I'm up to date if I don't know what I could have had that I didn't get?
And never mind, it's a perfect storm, because what you have here is not only a lack of awareness.
Right.
Most seniors have no idea that a pneumonia shot even exists.
That's right. So that's what I'm saying.
They have no idea. And then on top of it, as they get older, more vulnerable, there's other diseases that complicate the visit, right? So other things step into the fore. I've got my diabetes, I've got my arthritis, I've got my elbow, I've got whatever it is. You know, there's all this stuff that comes up.
But it's important. How can I protect myself if I don't even know what there is that I'm not getting?
Yeah, and just circling back to what you were saying about the coronavirus, I think, so certainly the flu vaccine does not protect you against coronavirus, but if you are older, the other thing people don't realize is that getting pneumonia or getting flu, getting shingles can be the thing that switches you from being able to live at home and do your own thing to being a frail, dependent, older person. And so they're really important for keeping you healthy and independent. Now, if you imagine, I think corona is going to come to Canada. It will be more widespread. If you want to stay healthy, you need to get your shots.
All right.
And people don't realize that. All
right, well, when we come back, it's a leading cause of emergency department visits every year. We'll tell you about that and how to protect yourself next.
It starts out as a cold, and then it morphs into, over a period of usually weeks, worsening cough, shortness of breath, sometimes chest pain.
Welcome back. Pneumonia is a potentially debilitating, even life-threatening condition and one of the most common causes of emergency room visits in Canada every year. According to Stats Canada, pneumonia ends up killing more than 6,000 Canadians a year, and 88% of these deaths are among seniors. So let's start with the obvious question. Pneumococcal pneumonia is the most common form of bacterial pneumonia. What is it?
It's a form of it's an infection of the lungs, which can be acquired through the bacteria that live in your throat and spread between people. And that causes people to really be very, very short of breath, to cough, to get a fever. The bacteria can spread into the bloodstream as well and cause infection in the bloodstream, which causes shakes and chills and can actually kill people quite quickly if it gets that bad. And it puts people in a hospital. It's not the only cause of this pneumonia, which makes it a little bit trickier to figure out what's going on. If you get the vaccine for pneumococcal pneumonia, this one type of pneumonia, you won't be protected against every single kind of pneumonia. Influenza also causes pneumonia. There are lots of different causes, and we can't prevent all of them. But this is a really big one, this particular one.
Do you think that, Iris, people underestimate the consequences of pneumonia in Canada?
I think it can largely go unrecognized because as people get older, it's actually harder to recognize it as a pneumonia when it happens. It can sneak up on them because older people are less likely to have fever. Yes, they can become short of breath, but often it comes from it starts out as a cold, as a regular cold, and then it morphs into, over a period of usually weeks, worsening cough, shortness of breath, sometimes chest pain. But because it's like the turtle in the boiling water, you know, it just is a gradual rise. I hate to use that because that's so gross, a thing, but I mean, that's a thing, right? So what happens is that the person does not necessarily realize how sick they are.
Now, there are two types of vaccines. What's the difference between both? And I've read from experts that patients, or frankly, seniors generally, should be getting both vaccines.
Yeah, so the one that everybody is recommended to have, and that is very cheap actually and is publicly funded, has got 23 types in it. So that's the one everyone can get. Not enough people are getting it, but it's available to everyone. So anybody who hasn't had their pneumococcal vaccine should definitely get that one. The other vaccine is a newer vaccine. It's the one we actually give to kids. And you can give it to older people. It's recommended for people with high-risk conditions. It works very well, but it's much more expensive. And because we're already covering 23 types in the old-fashioned vaccine, currently it's not publicly funded to have the other one. The slightly complicated factor about it is I think at an individual level, you are better off. It's just not worth spending the money to the government to pay for it. And so it's an individual decision, complicated by the fact that you are better off having that vaccine before you have the 23 one. It's best to have the more expensive one first. So it makes actually giving it a little bit more complex, but you can give them the other way around. It's just that's the optimal.
And you can get both, Angeline, at pharmacies, is that right?
You can. So as of 2016, pharmacists had their scope expanded to be enabled to administer a list of 13 vaccines, as well as the flu vaccine that was enabled in 2012. And so the pneumococcal diseases, vaccines for that are included in that list of 13. Mm-hmm. So someone could absolutely go into their pharmacy and speak to their pharmacist about whether or not that would be a good option for them.
They can get the publicly funded one, and if they did want Prevnar 13, which is the other newer vaccine that is given to children, incidentally, my daughter had it recently, then they can also get that through the pharmacies, but they'd have to pay out of pocket for it, of course.
Correct. So unfortunately, any publicly funded vaccine, a pharmacist would not be able to administer, with the exception of the flu shot. So if it was a patient looking for a vaccine that was not publicly funded, like the Prevnar, then the pharmacist would be able to help them.
So just really briefly, 2 vaccines. One is the Prevnar 13, and that vaccine is actually what the NACI guidelines suggest we get first. I researched a few pharmacies because I'm into drug costs and understanding what they are. And what's fascinating is the different pharmacies cost different amounts. Listen to this, $125 versus $180. Same product, Prevnar 13. So shop around if you've got to pay out of pocket for it. That's the first thing. The second thing is the government covers Pneumovax 23 when you're 65 or if you've got a high-risk condition, chronic lung disease, kidney disease, liver disease. Ask your doctor can tell you. And then if you're in that high-risk group, you get a booster when you're 70 in Ontario, but not everywhere in Canada. You know, so what's the difference between the 2 shots? Actually, there is a difference. There's not a complete overlap in what they do. So the Prevnar 13, that first one, it's better at reducing community-acquired pneumonia. Whereas the Pneumovax 23, that has its strong point in stopping invasive pneumonia. So we're talking about sepsis, bacteremia, so that's better for hospital patients.
A loved one recently ended up in the hospital, David. I mean, we've been talking about barriers, cost being one of them, access being another. But a loved one ended up in the hospital recently with pneumonia, and he didn't know, he couldn't say whether or not he'd had the pneumonia vaccine. I mean, how often do we hear that?
Well, this is what's so striking, because if we take this very important conversation we've just had in the last couple of minutes, leapfrog into the general layman's population, including myself, a huge percentage of what was said is unknown to me. What are these drugs? What's covered? What's not covered? Who's got it? Did I ever get it? I'm trying to remember. Did my doctor give this to me or not? I mean, so even if you start off with the best intentions, there doesn't appear to be a central source that marries what I've got, whether there's a registry of it or a record of it, with what's out there. And I maintain that for stuff like this, which basically affects the entire population, unlike, let's say, diabetes or hypertension or something where your doctor is likely to be the starting point. You know, you've been diagnosed with something and they give you a medication for it or something, you kind of know that you're in that group. Here, everybody's in that group.
And I shake my head in shame when I hear this. There's
everybody's in the group, right? But how many of us know in the audience, I'm going to hazard a guess, that the ins and outs of all this, 23 types, 1 type, Prevnar, now was it Prevnar they gave me? It's I promise you, a gulf that's very big between what you guys know and what we know on the receiving end. multiplied by the complexities of the system to get it paid for.
I totally eat the humble pie.
You don't
and
have
you
to,
know
I'm
what
not
is
saying, I'm just
missing in
saying.
this? We need robust vaccine registries.
For sure we do.
Robust vaccine registries that not only look at pediatric vaccines, but look at adult vaccines as well.
Yep, absolutely.
And registries that you yourself can go into 24/7 to see what did I get and what do I still need.
Couldn't agree with you more. When we come back, other critical vaccines you should be aware of and why. That's next.
So I ask, where is the financial sense in creating a barrier to seniors getting the vaccination, which we know is the more effective vaccine?
Welcome back. We've been talking about the importance of getting vaccinated as we age against vaccine-preventable diseases such as pneumonia. When it comes to the flu vaccine, uptake rates are still well below target. Surprisingly, a large percentage of older Canadians who consider themselves at risk for flu still choose to not get vaccinated. So let's start there. It's one of the primary fears of aging, becoming dependent on others for care. And we know that influenza is one of the leading causes of decline in disability in older adults, and yet people still are choosing to not get vaccinated. Why do you think that is?
The vast majority is because they just don't understand the benefits. It's not because they're outright vaccine refusals. If you look at people who are actually vaccine, true, hardcore anti-vaxxers, you're talking about, what, 2%?
Yeah.
Most of us just want education around it. We want to better understand what it is that's going into our body and what are the effects of that, both positive and negative. And when we have that kind of a dialogue, everything changes.
But do you think it has something to do with the fact, too, Natasha, you know, when we talk about the shingles vaccine that's out there on the market, how effective it is in the 90th percentile or in the 90th percent rate versus influenza, where the rates sort of vary by flu season because it's this constant mutating, I guess, disease. Do you think that that has something to do with it? They think that maybe it's just not as effective?
I'm sure it does. You hear these stories about, oh, it's not very good this year, but it's still the best thing we have. That's a very difficult message to sell. It's still the best thing we have to prevent influenza, even if it's a bad year. So how you get that message across, and the numbers sound, you know, when they say, oh, it might be 50% effective, that doesn't sound good either. But, you know, like you're halving your risk of getting influenza. That sounds a lot better. But, you know, sometimes we don't talk about it in the way we could to make it sound like it works. I mean, as I said, it is the best thing you can do to protect yourself, and we don't have anything else better at the moment. Everyone who works in this area knows we need a better flu vaccine. That's true. So we do need a better one, but that's still, you know, years out in terms of research.
Well, and for seniors, there's the high-dose vaccine. Now, Ontario is the only province that actually publicly funds the high-dose vaccine, which is, 24% more effective than the regular dose in seniors on average. And so this is great, but seniors can't always get to their doctor's offices to get this vaccine. Now, it is available in pharmacies, but not the publicly funded version. You'd have to pay out of pocket. How does that make any sense?
Yeah, so since 2012, the publicly funded flu vaccine has been available in pharmacies. In the last year, pharmacists gave over 1.2 million flu shots, which is incredible. But unfortunately, with the introduction of the high-dose vaccine, there's a number of different types of influenza vaccines as part of this program every year. And the high-dose vaccine is not available at pharmacies through a publicly funded mechanism. You could elect to pay for that vaccine and the pharmacist would be able to administer it to you. So it's not an issue of whether or not the pharmacist is allowed to give you this product. It's a matter of whether the pharmacist is able to give you this product for free. And it's unfortunate that we are not able to access that vaccine to give to our patients this year. We don't know what that'll look like next year, but we hope that
I see that as a real
barrier.
barrier.
Yeah.
There's no question. It's a barrier to the individuals over 65. We know that as we reach an older age, 65 plus, we start to enter that zone of immunosenescence, that rather depressing word that refers to the body's lack of ability to better fight infection. And that gets worse, 65, 75, 85, you become more and more vulnerable. So I ask, where is the financial sense in creating a barrier to seniors getting the vaccination, which we know is the more effective vaccine. That's ridiculous.
Did you get it?
Yes, high dose, yes.
You had
From
to go
my
to your
doc.
doctor.
Yeah.
Exactly.
But I think I want to just speak to something you said earlier about I think it's not just the information, but there's also misinformation. And there's a kind of a choppy story. And I'm, again, speaking for the audience, because the story is that they don't know how effective it's going to be before the season. They, and we don't even know who they are they guessing? Is it their best shot? Is it based on last year? Is it after it's all over?
David, it's based on the World Health Organization looking at epidemiological data, seeing what is out there, and determining what strains belong in the flu.
Okay.
There is nothing random about
But
what's
what
going
you
on.
just said is unknown. I'm talking about the perceptions of the audience. I'm not quibbling with the underlying fact. So we see stories in the newspaper. Remember, a little knowledge is a dangerous thing. I've given speeches to groups of doctors, and they tell me that their #1 competitor is Dr. Google. So you have a whole host of all of us here going online to Google, not really understanding what we're reading, not really able to evaluate it, a choppy story, unpredictable from year after year. Well, this year, 50, 30, but I think you got to go right back to the beginning, if I could counsel the powers that be, and put the fear of God in the entire population and make infection, flu, a automatic. If you're this age, you automatic, because who wouldn't want to be 10% affected better? If I could reduce my chances by 10%, why would I say no? If I could, but I've got to have a set, informed idea of how these respiratory problems affect my age group,
So
and what I can do about it.
Can I push
and
back
I got
on-
to tell you, it's all over the map. It's all over the map.
I agree with lots of what you said, but I don't agree with the sort of, I don't know, the negative messaging, in the sense that I think actually putting the fear of God into people generally doesn't work. Like, putting the fear of God into people about smoking doesn't make them stop smoking. I really think it's the doctor-patient relationship is absolutely key. Now, if I went to Iris and she told me to get any shot, I would say yes, because she'll convince anyone of anything, I'm sure. But like that relationship.
It's a vote of confidence.
Yeah, it's a vote of confidence. It's like, when you go and see your doctor, your doctor convinces you of things. Our doctors are too busy. They're too, they don't have systems in place that remind them automatically this person needs their shot.
Okay, let me just. I just want to end on one final point, because I would like to squeeze this in here, and we have limited time. In terms of other vaccines that are available for seniors, we can't not bring up the vaccine, the incredible vaccine that is available for shingles. Iris, tell us a little bit about it and why it's so critically important.
So 2 vaccines are available, just to make everybody crazy. There's Zostavax, which is the older one, and there's the newer one, which is now the guideline, called Shingrix. And the newer one reduces disease by 97%, hugely effective, not covered by any of the provincial ministries of health, which is a pity, because it is so effective. But that said, again, I checked the prices, and if you're going to the pharmacy, get ready. Anywhere from $123 to $250 a dose. Huge variations in cost, and they can administer it. The pharmacy can administer it for you.
All right, there's more after the break. Stay tuned.
We need robust systems that are universally available and including to seniors with mild cognitive impairment, who do not have the wherewithal to manage their vaccinations.
Welcome back. The sheer number of vaccines and changing schedules can make tracking vaccinations difficult, especially since Canada has poor electronic health records. So what can we do to ensure we are keeping track and up to date? Again, we've sort of touched on this, but so much of this comes down to awareness. So what should we be doing better?
Well, keep your own records, so people can actually, when they do get their vaccines, which everyone is going to go and do after seeing the show, they're going to go out and get all their vaccines, but keep your own records. I would like, there's a thing called Can Immunize, which is an app that you can get on your phone for childhood vaccines. I think we should have something like that for adults, because then it's like user-driven. It's not, we don't have to wait for the government to come up with a big project for a national registry, which will take you know, 3 million years. And they're getting better access to electronic medical records. I think AI might play a part in that because it'll be able to extract information from what right now is really hard to access information buried in your doctor's notes. So.
CARP has its own portal, David. CARP
We have a portal called Health 360, which does enable you to acquire your medical records in the first place and then use them to better manage your health. And we would encourage everybody to go on to carp.ca and find out more about that.
We need robust systems that are universally available and including to seniors with mild cognitive impairment who do not have the wherewithal to manage their vaccinations. I think the key here is robust provincial and territorial vaccination registries, which in fact send automated reminders to patients or their caregivers about what vaccines are needed well in advance so that patients are aware. Because I don't know how realistic it is to ask patients to know about vaccines. They don't even know what they got, never mind what they need. True. So it's like, let's get real. I think that the big thing is that as healthcare providers, it's ultimately my job to make sure they're vaccinated. So how can I do that? And the answer definitely lies in technology. And we're vastly underutilizing technology. I can just hear Walmart laughing at me when I suggest the utilization of barcodes. Why don't we just barcode it and boom, it goes right into the vaccine registry. Very simple idea.
Yep.
And you know what? That vaccine registry then sends the automated reminder to the patient. Hey, Mrs. Jones, you're now due for your Prevnar or Shingrix or whatever it is. And this is the cost. And this is where you can get it.
Well, and pharmacies can play a role there too.
Yeah, I agree with that. Pharmacists actually have their own system for keeping track of what patients have taken what medications, and we can do something called a meds check. In Ontario, we have the meds check program to sit down, speak with their patient and review their medications, and that can include, you know, what vaccines might benefit you, what vaccines have you had.
You need the registry.
But then
do you relay that? Can you relay that then back to their primary care physicians?
Yeah. So usually a summary is relayed back to the primary care physician after the pharmacist sits down with the patient and does this review. But it's a huge opportunity for pharmacists to be able to have access to this national registry, especially now with this expanded scope, to be able to make an impact in vaccinations and immunization, so that we can know where are the gaps, what can we address, what can we speak with our patients on, and if we are administering any vaccines, that can get updated in this national
Realistically,
registry as well.
It begins with a provincial and territorial registry. I think the idea of having a strong national registry, there's no way that's going to happen. It's going to be built out of the provincial and territorial vaccine registries. Once those are robust, then you can take the information, get rid of the private stuff that's there, and then create the national vaccine registry.
People do have those fears, though. I mean, they're collecting all of this data, all this personal information about you.
That's
I think that is another barrier for people. I mean, I think people might be worried about it.
There's one modest suggestion I could make going in the other direction, and maybe fear of God, I overstated it before, but I think that the patient population or the lay population, and I include myself, should be better educated to ask their doctor what the state of play is. So I keep coming back to the fact that adult immunization, the word adult, is a relatively new thing in the lifetime of, let's say, a 65 or a 70-year-old or an 80-year-old. It hasn't been around for 80 years. There's been a jump from what happened when I was a kid. Now, all of a sudden, I'm a grandfather. I'm speaking of the generations, and suddenly there's all these new vaccines that I never heard of, that I kind of vaguely know about flu. Maybe I heard about shingles, maybe not. If we could all be trained, and if one of the takeaways to our audience is, the next time you see your doctor, just raise the topic.
Absolutely.
Raise
and
the
vote
topic.
an appointment to it.
Book an appointment with your doctor and ask the doctor.
Or your pharmacist.
Or your pharmacist.
Or your pharmacist.
Absolutely.
No, absolutely, because the pharmacists, and we've had this discussion before, there's, I don't know, 10,000 or so outlets, much more close to the community, much more close to the neighborhood. What's out there? Maybe ask the pharmacist what you should ask your doctor.
There are so many ways to
we have to take
this
this into our own hands and say, I'm now aware, I being the patient, that there's this thing called adult vaccines. It can make a life or death difference to me. I'm underinformed about what's on the market at all, let alone whether I've gotten them. I'm going to make a point the next time I see my doctor, or I'm going to make an appointment with my doctor specifically for this topic, because why wouldn't you want to know about this if the stuff's out there?
Dedicated appointment, I think that's the key.
It.
A dedicated appointment.
Yeah.
That's how long it takes to actually go through the recommendations for individuals over 50. Guess what? There's a lot of stuff on that list. For all the talk about measles, there's thousands of pertussis cases, whooping cough cases a year in Canada. So every adult's supposed to have that. We didn't even talk about tetanus, diphtheria, pertussis. We've mentioned shingles, we've mentioned pneumonia.
There are booster shots people should be getting every, 10 years or something like that.
Yeah.
I think everybody in this room or everybody at home that hears this should make an appointment with their doctor and say, I want to see you for a consultation about the wonderful world of adult vaccines. What is in this world? What do I already have, or what do we think I have? What do I need? Because the irony here, and I'll just touch on this for a second, is that Zoomers, our population, and particularly members of CARP and readers of our Zoomer magazine, way over-index as seekers of information about health. It's the irony. We are going onto health websites. We are reading the ingredients on packages. We are looking for the information actually way more than younger generations are. So we are already primed to go out and get this info. Let's turn our attention to adult vaccines and go get the info.
All right, well, when we come back, we'll take questions from the audience. That's next.
So we've got 30 cases in all of Canada of COVID-19 put in quarantine. True, but they're basically common colds. 1 pneumonia, 1 death.
Welcome back. It's that time in the show when we take questions from the audience. And now we welcome Claire. Claire, thank you for coming to the roundtable. What's your question?
Thank you. My question is not about vaccinations. It is about COVID-19, which the entire world has almost foremost on their mind. Some people will not go near an airport until this is entirely disappeared, and others feel they're putting it into perspective and have the attitude that you have a far greater chance of catching the common flu than COVID-19. And I would like to know, please, how you would address this.
Oh my gosh, well, you're talking to a
That's a
person who
loaded
is
question.
so firmly into that second camp. Let's do the math here. So we've got 30 cases in all of Canada of COVID-19. If I'm to understand this correctly, 29 of which are basically common colds. Common colds. Put in quarantine. True, but they're basically common colds. 1 pneumonia, 1 death. So what am I to do as a family doctor now that we know that the number of cases outside of China has exceeded the number of cases within China? That we have transmission with no history of travel. We have transmission with no history of fever, necessarily shortness of breath or chest pain. So what do? Personally, I lump it into the same category as any type of influenza. The chances of this influenza becoming the next Armageddon, for all intents and purposes, is probably 0. It's not 0. Okay, let's be theoretically honest. It's probably 0.00001, but it's out there. Okay, we got to consider that. But as far as stopping traveling and stopping what you're doing, I refuse to feed into this craziness that's going around it. Is it important to count? 100% it's important to count. We need information. We need knowledge. But I think at this point, it has gotten so large that we have to question what even constitutes reality.
And while I always agree with your expertise, people that do fall into categories where they're more vulnerable obviously have to take some precautions.
Yes, I mean, it's the same precautions as the influenza or any other virion out there.
Now, Natasha, what is the process for developing a vaccine for COVID-19?
It takes a very long time because you have to understand the virus. So when you have a new virus, you're starting from 0. almost from zero. There have been people studying coronavirus as a type of virus, but this specific virus, they haven't been. And so trying to figure out how to make that into a vaccine is really hard. And you have to remember, this is a virus that's come from an animal, which also changes things because the way human beings respond is different, and we don't necessarily have a good way of testing it in an animal that's similar enough to human beings. You know, we do some tests in monkeys, and that is really expensive and hard to do with these small numbers of animals. So it is very, very complex, and it takes a long time to get as far as something we think might be a vaccine. And then the number one priority is making sure it's safe in people. So you have to give it to people who are healthy to find out, you know, how they react before you can even think about scaling it up to the general population. So it's normal to take 10 years to develop a new vaccine. And at the moment, everybody's trying to do that as quickly as they can. The thing that's going to happen before, I think, a vaccine is available is treatments. And the thing we can do now is try and buy as much time as we can to get treatments available. And we know a lot more about how to develop antiviral medications, they call them, and people are working flat out on doing that as well. So a lot of the public health response right now, we've given up on trying to contain it in China. That's obviously not going to happen. But if we can slow it as much as possible, then that buys time for scientists to get as far as they can in getting antivirals. So that's what we need to do. And while I completely agree that nobody should be panicking, I know lots of people are a bit, don't really take hygiene that seriously. So what you can do is do the normal sensible stuff. Use hand sanitizer, keep your hands clean, take care, cough in your sleeve, stay at home if you're sick. Stay away from other people who are sick. If you are sick and you have to go somewhere, you can put a mask on to protect other people. So there are things that people can do to protect themselves, but panicking is not helpful for anyone. You need to stay healthy. Good night's sleep, take vitamin D in winter, things like that.
All right, thanks. Dawn, welcome to the roundtable. What is your question?
My question is, I've had both pneumonia and I've had shingles. Now, with the pneumonia, I had a pneumonia shot after it, not before. And with shingles, I had it, I had the shot before I had shingles, so I had a very light case, I would say, of shingles. And I guess in both cases like that, and maybe as we've been talking about other things we should also be getting, should I be getting booster shots, I guess, in both cases to continue to maybe protect me for the future?
So the answer to that question depends on what products you had and what your other medical conditions are and how long ago those vaccines were.
The shingles was at least 10 to 15, both of them are at least 10 to 15 years ago.
Okay, so the shingles shot, you would have had the old one, which is the Zostavax. So at this point, you're probably sitting at around 40% efficacy versus close to 90 to 95% efficacy of the new Shingrix. So the NACI guidelines, that's the National Advisory on Canadian Immunizations, their guidelines would suggest you need to get your Shingrix, and that's 2 doses. Remember the cost differentials that I talked about, because you're paying out of pocket for that. Despite your age, despite whatever problems you've had in the past, they don't care. You got to pay. Sorry. Okay, so there's that, and then there's the pneumonia shot. So we talked a little bit about it. There's 2 products, so I don't know which products you've received. There's the Prevnar 13, and in an ideal world, you'd pay out of pocket for that Prevnar 13 first, and then some 8 weeks later, you would be getting the Pneumovax 23, which the government will cover the cost of. So you can have a booster shot in 5 years if you're a high-risk group. So that's kind of the way it works.
Okay.
Thanks, Dawn. All right, well, when we come back, final thoughts from our panelists. That's next.
Don't forget, for free tickets to the show, go to www.universe.com and search Zoomer Media and log on to www.thezoomertv.com for full episodes and more.
Welcome back to the Zoomer. It's time for final thoughts from our panelists, and we'll start to my left. David.
Well, as the only voice of the uninformed layman on this panel, what I've learned, and I would repeat to everybody watching, adult vaccines are a thing now. They are being developed. There are new ones we don't know about. Our ideas of it just a childhood thing and then you've had your shots and then you're done for life is not true anymore. So let's take responsibility for our own health and well-being and make it an issue, make it a topic with our doctors, and do everything we can to get the facts of what's out there, what we've had, and to have a plan every year. What am I going to do this year to protect myself in relation to what's available in the market? And there's no excuse not to know what's out there. We can all go to our doctors and make it a topic.
Don't forget the basics, the very pillars that define wellness. There are so many aspects to this that we didn't touch on. We touched on the hygiene aspects. We touched on the vaccination aspects. But sleep actually plays a critical role in the body's immune response and the body's ability to fight off infections. And one very quick addition, wash your mouth, for heaven's sakes. Where do the viruses come from? In hospital, we know that when patients don't brush their teeth and don't wash their mouths, they literally are breathing what's in their mouth into their lungs, and that's a problem. Brush your teeth, sleep well, basic stuff.
I think we've talked a lot about education on, what's out there, what vaccines are available and necessary. I think for me, a part of it is also education on the fact that your pharmacist can help you. You can have a conversation with your pharmacist about vaccinations. They're educated on the matter, and they're now able to provide some of those and administer some of those vaccines to you, and they can be a key part of that system for a patient.
So I think the whole public health system has to address the needs of seniors better, and it's not. It currently is very focused on kids, so I would like to see that change. But if it's a message for your viewers, it would be, don't just think about yourself, but tell your friends, because that message is also really important. You need to look after yourself, but if you tell everyone else when you're going to the doctor, hey, I'm going, you may bring a few more people with you.
All right, well, that's all the time we have. A big thank you to my panelists for being here and to our studio audience. And for those of you at home, we'll see you soon. For now, it's time to zoom out.